Hey guys, it's Shruthi from TaHB here at Dallas, Texas, and for our August issue, we had the amazing opportunity to interview Dr. David Langer. Dr. Langer is the chairman of neurosurgery at Lenox Hill Hospital, and he is also in the Netflix docuseries Lenox Hill. And if you have not seen it, go check it out right now. It is super inspiring, and it beautifully showcases the life of 4 doctors, including Dr. Langer. In this interview, he's going to be answering some of our questions today, so let's get to it. I was a little nervous, reasonably so. He is someone we all look up to, but enjoy. I want to start off by thanking you for being with us today. Our magazine focuses on spreading awareness about healthcare globally and providing a platform for the youth to kind of learn and verbalize their opinions. And with Lenox Hill, their docuseries has really been a source of inspiration for a lot of us. So I think you have become someone we all really look up to. And also congratulations on being ranked one of the best hospitals for neurology or neurosurgery in the nation this year.
That was nice, you know.
Thank you. So to jump right into the questions, let's just talk about how COVID has changed your day as a neurosurgeon, because I can imagine that a lot of people were kind of scared to come in for surgeries because of the virus.
Well, I mean, originally we didn't really know what to expect. We had to shut down all of our elective surgeries in early March, and by kind of March, April, we weren't really doing any neurosurgery. It was I think part of it was a lot of people with real emergencies were staying home or weren't coming to the hospital at all. And then we did have a few every now and then, but there were basically anybody who could wait was waiting, which wasn't always smart. Subsequent to that, we haven't seen a real big spike in emergencies, which you would think you would. And we're sort of back to normal, at least is the amount of volume we have. It hasn't gone above what we normally have. It's actually still a little bit below, but that's partly because New York City, I think that a lot of people have left New York temporarily, hopefully, and also people in the suburbs or the surrounding tri-state area that might have used to come into Manhattan, I think they're choosing not to. It's not that makes any sense, but everything's a little different now, just people are a little more reluctant to travel to, you have to park and, so there's a lot of hesitancy to do things were otherwise normal before. And I think all those things contribute to a little bit of a change in the types of cases we're doing. One of the ENT surgeons said that all the itises are not showing up, meaning if you're fine with an antibiotic and staying home. Whereas people who have like sleep apnea because your wife is torturing you because you're snoring at night, those people are all coming in.
Yes.
We see a variability in what types of cases are coming also based on some quality. People with back pain aren't coming. They said, I went to bed the last 4 months with this. I can live with this. I don't need an operation.
I can deal with it. I don't need to go to the hospital.
So that's why there's some variability to the volume coming back.
Okay, of course. So like in these 3 months since people have gotten more used to the virus, you've seen like change in the way people were approaching hospitals now? Are they getting more used to it, like you said?
I think so. I mean, New Yorkers are, we went through probably the worst of it. And so in some ways it's good and bad. It's good because I think there's an awareness and a sensitivity to how bad it can get. By the same token, I think there is some unfounded fear now and I think it's very safe to be in the hospital. I don't really worry about it personally.
Yeah.
But I think there's still, I think the reluctance to come in is dropping.
That's good.
And it probably won't completely go away for at least the next year or so, I would imagine, until there's a vaccine.
Yeah, for sure. So you talked about New York and how you guys went through like the hardest part of this pandemic. What tips do you think you have for like people in other states or maybe even like other countries to see COVID cases drop kind of like they did in New York?
Well, New York's a unique place only because it's an international city. I think that there was probably a lot of underlying infection there in January, February, way before we even knew what was going on. And so it was a sort of an unprotected population. And so even when the mayor and the governor shut us down, we were way behind the 8 ball. The trouble with when people talk about America having, a double, like 2 hits, it's not true. It's the first bump is all New York. And the second one is everybody else. And it's just that no one believes it. I don't know. Do you watch Game of Thrones by any chance?
No, I feel like if I start watching it, I'm never going to stop. And
well, Game of Thrones, there's the White Walkers are the undead are out there, and people keep talking about them that these people exist, and no one believes it. And until they are there and killing everybody, it's until you see the enemy in your face, and it's still this kind of, maybe it'll happen, maybe it won't. Also, it's because of the politics of our country. New York's a democratic city. The liberal media, quote unquote, promotes things that, and so that added a whole other element to this that's unique to the United States.
Mhm.
But I think that people are, once you go through this early peak, there's an element of probably cross immunity to other forms of the coronavirus that protect some of us partially.
Mhm.
And there are other people that are super spreaders that get the virus early and spread it. And
Mhm.
once those people have been infected and have antibodies, they're not going to be able to do that again. And so that's why I really think that the infection rates start to drop, with relatively decent social distancing and masks, whether you wear them. I mean, this whole thing is nuts. But in
Yeah.
the end, I think that there's going to be a certain element of infection that the population gets to, and then you just start seeing the drop because that's how the virus works.
Mhm.
We don't know what the percent of cross immunity is. We don't know the importance of the super spreader, but I don't think in reading about T cell immunity and some other things, I think that it's unlikely you need to get a 60 to 70% herd immunity number. It's probably a little less than that.
Mhm.
So that's why the numbers are coming down, and I think people are social distancing relatively well, depending on where you go, but everybody's learning their lesson. That's for sure.
For here in Texas, we have our adults and then we have our kids. Some of the college kids are like, whatever, let's just go party anyways, go to pool parties and spread the virus. And then some people are like, no, we need to stay home. So like this, we have even in Texas, we have like both sides. We have people really, really scared and staying home, and then people who do not care. They do not care.
The problems really is, I think, the way this is being kind of the signaling from our leadership and the message that we're getting is incorrect.
Yeah.
The reason to social distance is it shouldn't be you shouldn't worry about yourself. The chance of you getting it and getting sick and dying is essentially zero. I mean, it's just it's not going to happen. If it does, it's reportable basically. But the reason to do that is prevent everyone else from getting it. It prevents spread because the most vulnerable can get it.
Exactly.
And the hospitals get overwhelmed if there are too many people with the infection. So that's what's just so maddening about this whole thing. You shouldn't be. I mean, this whole fear, like people freak out about. It's not about you getting the virus.
But you spread
People screaming at each other for not wearing a mask. I mean, just remind people, wear a mask. I'm not worried about getting it from you, but you should be. I want to prevent you from getting it from me. So it's just hasn't been handled well. And
not the one person benefits type thing. It's like a community works together.
It is. You're doing this because it's your neighbor. It's caring for the person next to you. I think it's just terrible. The whole thing is it just really upsets me. And I think perhaps Lenox Hill, it came out, in some ways a bad time for us because we were unable to really, see people face to face afterwards and spend the time to enjoy that aspect of it. But it also, I think, was the best time to come out because it's really symbolic and really is a message of what caring looks like.
Exactly. It spreads so much awareness about what healthcare really means on the doctor's side of things for everybody, even globally. I have friends in India watching it and they're like, wow, that's crazy. They're like, doctors aren't always just doing your case going on. They have so many things and they're trying to help everybody. They really personalize their care for every patient that they have. And I think that's really amazing.
I mean, also, just not to cut you up, but I think that one of the problems with physicians and healthcare in general is we've done a terrible job at expressing ourselves and letting people in. And so when patients have this, and the thing is, the feedback we've gotten, this was the best thing we could have done because there wasn't an awareness. Everybody thought of Grey's Anatomy or, whatever, that was their filter.
Yeah.
And, we have to, in order to get, we don't need the sympathy from the public or even empathy for us, but there just has to be understanding of the complexity of the environment we're in and how difficult it is. Not that I'm complaining, but when things don't go well, or if you think that the physician is some sort of all-powerful being and can control everything, it's quite chaotic many times. And I think that if we can message that better, it's better for both sides. Patients will be a little more understanding and more empathetic, and physicians will let their guard down a little bit. I mean, I've had friends call me who are really top world neurosurgeons, calling me and talking to me about their personal lives and how something happened. This never used to happen. And I think that's the best thing of all. It's opened up, our world to you and it allows us to really feel more comfortable about being human and real rather than robotic and fake. So
Exactly. I feel like, yeah, everybody has this like mindset that doctors are just, they're like superhuman. They're always thinking at a different level, feeling at a different level. But at the end of the day, they're just people too. And I
Yeah.
think it's really important to understand.
Yep.
So, how do you think COVID will affect future healthcare in the US? We kind of talked about this, but how do you think the future is going to be responding to this virus, or even if when it's gone, how do you think they're
It
going to
probably
be?
depends on the government. I mean, I think
Yeah.
that locally we're fine. I mean, we understand how to treat the disease. And there's more of a relative understanding of the importance of public health
Mm-hmm.
and resourcing that properly. I think the supply chains and the way that, the way medications and PPE and, the way we move these equipment around they'll be hopefully it'll be better organized. Also, I think that large hospital systems have to come with emergency plans to kind of load shift patients when they get sick. That was one thing our health system did really well because it's so large, but it needs to be done at a state level or even at a national level so that, if there are pockets of flares and you can't let the hospital systems get overwhelmed. And so this requires, a deep understanding of what a pandemic looks like. It requires a lot of governmental organization, the military, FEMA. But, until we have an election, if we don't have a leadership change, nothing's going to change, and I think that's because that there's a certain element of the current administration that has a relative lack of empathy and doesn't, it's not part of their culture. It's like you can't convince anybody of anything. It's just what they believe in, and they believe in individualism and, it's not selfishness is a negative word, but it's very selfish. It's like I'm doing what's best for me and screw you. And that's, there's a significant amount of the population that believes that, and that's just the way it goes. It's not just unique to the United States either. So unfortunately, that's what's in charge. And until that changes, nothing's going to change.
Well, we're the United States. We're not individuals. So like, I guess we need to work on that. Oh, I'm free. I'm in America. It's more like, I feel like everybody's approaching those words differently. And I think
Well, that's politics. And that's, you really have a minority running the majority, and you have a incredible, series of events that have really, I mean, the virus, people say natural disasters draw people together, but pandemics drive people apart. After a natural disaster and everything collapses, I was in New York for 9/11 and I was in New York for this. 9/11, there was this massive, outpouring of grief, but everybody ran to we went down to the World Trade site, as physicians, we couldn't really do anything up in the hospitals because no one was showing up. So we all run there, and the firemen were there and the police were there, and everybody was so helpful and loving, and the people were giving out free food, and it was for a few days, it was like Shangri-La, because people were so nice to everybody. Pandemic's different because you can get infected from the other person, and it's almost like pushes people away, and that it's like this isolation and this dreary, moon, almost like a cityscape that was, coming home at night through March and April was just incredibly depressing, And so, not to mention the weather was awful, but this is why infections and viral, these sorts of things are just so different than a natural disaster or a terrorist attack. And that's why it requires even more leadership and more kind of guidance. The public is very susceptible, and they're all worried about themselves first, which is understandable.
Of course. So now I'm going to give you this perfect world situation that I'm sure like a lot of us wish were true. If someone would have to like, I don't know, warn you about the pandemic, like well before it happened, what things do you think you would have done that like could have subsided the effects of COVID if you had the control over it?
Well, first of all, I think you have to have appropriate training and support of the medical staff. We knew, we had to learn about, what the appropriateness of PPE is, what type of PPE, what the way to manage a patient, when they're coming into the hospital. I would have made sure that we are prepared with the appropriate ventilators, that we have enough ICU beds, that we have enough step-down beds, that nursing is cross-trained, that we have a strategy to deal with the intensive care load. The testing, obviously, would need to be significantly ramped up. There was essentially no testing. And then I think of public awareness, like just the public can do a lot. They have to understand that this whole concept of that you're not protecting yourself, you're protecting the other, but that's better for yourself.
Yes.
It's and to understand why this is important. And I think that you'd have to work with businesses also, to come up with some strategies to, make it safe for takeout food, or, basically have different ways of shopping or buying things.
Yeah.
Because the economic impact was what's really dramatic, caused the most distress. How to deal with schools, and how to keep educating our kids, and how to, set up all these Zoom things, and
Yeah.
making sure that our most at-risk populations have access to these things, and that requires money. So, I'm an eternal optimist, but I'm very pessimistic about this. I just don't think that we have the resources, both up here and in here, to fix these problems, and that's why this will happen again. Hopefully we'll be a little smarter about it, but there is some inherent cost to this that are going to be hard to overcome. People have a short memory too. I mean, the same thing happened in 1918. No one was alive. No one was alive. Very few people are alive from then. Sure, those same lessons occur then too. But this is the human nature.
Of course. So finally, I just want to close off by saying, what words do you have for future doctors or aspiring medical professionals that maybe are kind of scared about what they want to pursue because of this virus?
Well, again, I wouldn't be scared. You can't have fear. Even I wasn't really afraid. I mean, look, I felt like I'm going to go in the hospital. I'm going to make sure I do what I'm supposed to do. And look, if this was Ebola or, say AIDS, you could say get AIDS from aerosol, or it's not AIDS. This is basically a glorified flu that has a death rate that's actually less than flu.
Exactly.
But it's just, you have an uninoculated population, so you got a lot more people getting sick.
Yeah.
And if you look at the number of people who died, half the people were elderly or infirm to start. And it doesn't mean you shouldn't be afraid of it, but you should be afraid of spreading it. And so as a young student, you want to take risk to get to, you need to. I mean, everything we do has risk. Obviously, you don't want to put your life at risk, but if you can avoid it. But I think that there's something noble about our profession, and either you're going to buy in the fact that there are things that you can, infectious diseases that exist that you may be susceptible to them. And if you're really fearful of dying or being infected from something, then it's probably not the right thing to do. Because there are always going to be these things in your lifetime and in your career. Like, I'm 57, this is my first time I've confronted something like this, but I wasn't afraid of it. this is my job.
Yeah.
And I think that in your lifetime, if you become a physician, there'll be something else that comes up, and you'll approach it in a professional way. You'll do the appropriate things to manage yourself, but it's still the best thing to do. I think as far as a profession or anything, it's not perfect, but compared to sitting at a desk or focusing on the computer all day, or there's nothing. The energy of it and the challenge, both emotionally, physically, intellectually, the complexity of my job and what I deal with every day is incredible. I don't love it all the time, but when you sit back and you realize that the problems and you have emotional issues, you have your team, you have the patient, you have the science and the emotion on that side, and plus you have the bureaucracy, and it's a business. You get to do things that have to do with money and growth and marketing and teaching.
Everything.
It's great. It's why I'm so tired, but I'm done. But no, it's a great thing to do, and I would encourage anyone who, it's not for everyone, but I would encourage people not to worry about things you can't control.
Exactly.
And to go and go forward with hold your head high, work your butt off, and find the type of things you like to do. Obviously, if you're really fearful of things like COVID, there are some specialties in medicine or even non-clinical stuff you can do and still work for the betterment of other people. But it's hard to fathom that if you're really built right to be a doctor, that you not want to do that too, because that's when you define yourself in these chaotic times.
It's like any other job, it comes with risks, and this is one that is just built into the job. So if you're wanting that, I think you should be ready for it, kind of.
Yeah.
And I just wanted to say, I cannot believe that you look so young. I'm not trying to say it just to say it, but I was like, no way. Because I remember watching
in the Netflix show, you go into the gym and everything, and you work out way more than I ever have. And I was a dancer and everything.
You know, exercise keeps you sane, so it keeps you
Yeah.
younger too. But no, I was born in 1963.
Oh man, I was
I
born
was born
2001.
in June, so I was born 5 months before JFK was killed. I was alive for that. I don't remember it, but yeah.
Dang. Yeah, I was born 2001 October, so almost 2002.
And my
And
daughter is 17. She's was born in 2003. She's applying to college this year, so
that's exciting. Stressful, exciting though.
yeah, yeah.
Thank you so much, Dr. Langer, for your time. We really, really appreciate everything you do from like spreading awareness and just like supporting us future physicians and healthcare professionals. Thank you so much.
Feel free to reach out again. It was my pleasure. And remember, I'm not a celebrity. I'm just a doctor. So, you know,
I know.
that's a little uncomfortable for me too. So, you know, just keep, you know, you can do whatever I'm doing, you can do too. It's just a matter of, we were very lucky to have this exposure. But the truth of what we were doing every day, anybody with a heart and with a mind can do it. And that's really the truth. So.
Thank you. Thank you.
Right.
Stay safe.
Okay. Bye.
Bye.